and the relationship between testosterone and dementia. And as we have shown, testosterone levels decline with age, and in conjunction with this, dementia increases with age. And what we have done is we've looked at women who are postmenopausal, and we've looked throughout ages and shown that androgens are related to cognitive performance in women. And then we've looked at postmenopausal women on non-oral estrogen replacement and done a series of cognitive tests in these women. The first lot of cognitive tests we did were traditional tests such as verbal memory tests and drawing pictures and being able to reproduce pictures, and we showed that with traditional testing, testosterone improved cognitive performance. The problem with traditional tests is that we all will perform better every time we do a traditional test. If you have to draw a picture and you're asked to reproduce it again half an hour later, the more often you do this, the better you'll get at it. So to get around this issue of cognitive performance, a group of Australian psychologists developed what's called CogState. And CogState is a battery of computer games where one plays card games and goes through mazes and does other computerised tests. And after one has familiarised oneself with the test, one doesn't improve simply by learning. And CogState is now being used by a lot of sporting groups around the world because if, for example, a jockey falls off a horse and has a head injury, the jockey in some countries is not allowed to ride their horse again until their CogState testing has resumed what it was for them in the past. So there's no learning effect with CogState. It really is a very genuine test of a range of cognitive performances. And we have looked at women with testosterone therapy and compared them with control women and shown that women treated with testosterone compared to controls have improved verbal and visual learning and memory. And in addition, we subjected women to functional MRI scanning, and this is why I have this picture here. And in the study, women were asked to do two tests. They were asked to do a visuospatial test where letters from the alphabet are rotated around an axis, and they're either to report whether the two letters are a mirror image of each other or a rotational difference from each other. And we found that with testosterone therapy, women improve better on the tasks of visual imaging in the more complex rotations and letters. But the important thing we found is that their improvement over 6 months was associated with a reduction in the signal in the MRI scan. So they were repeating the tests after 6 months, but requiring to recruit less neurons in the brain in order to complete the test, which was evidence that testosterone was actually affecting their cognitive performance and affecting oxygenated blood flow in the brain. And then what about other aspects? Well, testosterone is important for muscles and particularly important for the pelvic floor. Furthermore, we tend to attribute vaginal health and vaginal dryness after menopause to loss of estrogen. But very elegantly, Sandra Liebler many years ago showed that women who had a low vaginal atrophy index, the best correlate was having a higher testosterone, not a higher estradiol. So testosterone is important for vaginal blood flow, for the pelvic floor musculature, and also for vaginal health. So testosterone is important for reproductive health and a whole gamut of other non-reproductive factors in women. What about breast cancer and risk? Well, there have been concerns that androgens may be bad in terms of breast cancer risk, but I would put to you that androgens are probably the endogenous protectors against breast cancer, particularly in premenopausal women. Testosterone is apoptotic and anti-proliferative in the breast. Importantly, insulin resistance and obesity is associated with significant increases in breast cancer risk. 80% of breast cancers have insulin receptors. Therefore, theoretically, polycystic ovarian syndrome should be a risk factor for breast cancer, considering these women have insulin resistance. But what we see consistently across studies is that women with polycystic ovarian syndrome, despite their insulin resistance, do not have an increased rate of breast cancer. And I would put to you that it is testosterone in these women that is protecting them from breast cancer risk. Now, I'm would be fairly certain that Dr. Legros is going to stand up here and tell you that testosterone causes dreadful side effects like hirsutism and acne. Now, it's essential before we draw conclusions about effects of any hormone or any factor in biology that we do randomized placebo-controlled trials. We've recently been doing a randomized placebo-controlled trial, as I said, of testosterone in postmenopausal women looking at cognitive function. And my next picture is to show you the placebo effect we saw in this study of placebo therapy in 2 of our subjects, as evidence that if you don't look at a placebo group, you can't make any conclusions about an intervention group. So this is 2 of our patients treated with placebo therapy. Now, Dr. Legros would jump to conclusions they must be on active therapy, but indeed they were not. So finally, although we're talking generically that androgens are good for women, but women do not live on the earth in isolation, and testosterone in men is also good for women. And I would put to you that without testosterone having favourable effects in men, women would be very dissatisfied individuals. So I'm sure I've convinced you that testosterone is not only good for women, but good for men, which is good for women. Thank you.
I now call upon Professor Richard Legros from the US